lifting over 19 years. And I work in the community for now. We deal with from dying eye drop to dying patients. And you know, because we have so much diabetes now, we deal with a lot of them in the community. So I'm just going to be a brief overview of what is diabetes type 1, type 2, and management briefly. We can't go in detail. So do I have a slide? Okay. If not, I'm gonna. No, I got my sheet if they have a slide. It's okay. Okay. The first thing is, while this slide is coming up, I will just speak. If you have any question, please listen. I'm not going to give you everything you need to know, but I'll give you a brief, and I pray whatever I say, God will give us knowledge and understanding from above to make use of it. So the question is, what is diabetes? Diabetes is a condition where your body cannot produce insulin or doesn't have enough insulin.
Yeah.
And in some cases, your body do not use it properly, even if it produces insulin. It doesn't use it properly. So, but insulin, what is insulin in the body? Insulin is produced in your pancreas. So we have many types of diabetes, but a two common type of diabetes, which is type 1. Type 1 is for the mostly young people. And the onset is called juvenile because it's young people. It's suddenly, and you have sudden loss of weight. You have all the symptoms of type 1 and type 2 is the same. But the difference from type 1 is you have sudden loss of weight and unexplained loss of weight as a child. And then you have you have urination, going to void urination often as more than you can, more than normal. So you ask yourself, what is happening? Then it's time for you to go and check. And type 1, you get type 1. There's not much explanation on why people get type 1. Sometimes it's caused by and sometimes it is caused by infection damaging the pancreas. Or sometimes it's when you have it in your family, then it's a family history. It's more likely. Or sometimes family history. But you get it in young people. Young people, as I said, mostly. But you can live with it till 100 years, depending on how you manage it, which is where we will focus our presentation because of who we are and what we are. Then type 2 diabetes. Years ago, we used to say from the age 40 or 45. But I tell you, early 20s, it's not juvenile. You get diabetes due to the lifestyle we are living now. And 30s, you get type 2. And type 2 is mainly you can have family history. But mainly type 2 is due to our lifestyle. Type 2 is, I would say, sometimes it's self-inflicted. What we eat, sedentary lifestyle, not exercising, being greedy, and the way we eat sometimes causes, most times, that's how we get type 2. But to tell you, diabetes is a serious condition according to Diabetic UK, and it's an increase. Many years ago, we are saying about 4.7 people will have it. But now the number is going up, like 12.something million people will get it because of sedentary lifestyle. And especially since the pandemic. I'm sorry for the pandemic generation. There will be a lot of long-time condition, and because we call diabetes long-time condition. It is something you can live with. It's something you can manage. If you know how to manage it, you can have type 1 from age 6 until you're 100 if you manage it properly. When you have type 1, we refer you to Daphne. There is group we refer in UK. If you have type 2, there is group we refer at early onset so that they can teach you how you will manage and live with diabetes. Long-time condition are the condition you will learn how to live, and you will live it with it. You manage it, and you manage it. And type 1, as I said earlier, we manage it with insulin. You cannot avoid type 1, but if you get it. If you're predisposal, you cannot avoid it. But if you're predisposal for type 2, you can avoid it. You can stop it. You can stop it from manifesting due to changing your lifestyle and exercise and the food you eat. And when we say the food you eat, I'm not saying I don't see any diabetic patients, I say go on diet, go on diabetic food or buy this. Because you need to look at people holistically. If they cannot afford it, they will eat 1 week, 2 weeks, they will go back to what they can afford. So you look at people holistically and you give them, on your assessment, you give them the management they can manage for a long time. Like cutting down the portion, taking off few things, but eat your normal food, but cut the portion, and exercise. You eat food because you need food. You don't eat food because you have to eat food. Don't eat food because you see food. Don't eat food because it's in my plate, I have to finish it. Then what you do is get yourself a smaller plate to dish your food, to train your tummy, train your discipline. As you discipline your body in other things, so you discipline your body in what you eat. You can eat anything, everything, but in moderation, small portion. Leave it. When you go to a dinner party, you can see how your food is dished out. Do you not get full up? And again, if you eat, you're not active. You're just eating and pounding it. The body can only use what it needs. The remaining one is stored as fat. And that's why you have to eat what you need. And you need to exercise. You need to go out, even if you can't run. Don't join the gym. I'm not saying join the gym, but walk. Do the stairs, walk out, come in. Do what you can to live an active lifestyle, and that will help you to reduce and eliminate type 2. But if you have type 1, if anybody here has got type 1, what I will stress on is compliance. Please, if you're long-time insulin, long-acting insulin, and slow, administer them. If you don't know, ring your GP, ring your nurse, diabetic nurse, whatever they said, you do compliance. Do it. Don't say, oh, I will pray or God will do this. God has given you choice. God has given you knowledge. God has given you experts who direct you to experts who can direct you. And whatever they say, comply with the instruction, comply with the treatment. Otherwise, you will end up with diabetic complications. And diabetes don't kill anybody. It is the complications that will kill. So apply by it. Thank you.
Praise the Lord. So I'm Deaconess Olubukola Oguntuashe. I'm a registered nurse in intellectual disability. And I'm the youngest here. I've been a nurse for less than 3 years. Amen. So I'm going to focus on hyperglycemia. So that is when your blood sugar is high. So hyperglycemia. So what happens when you don't make insulin, when you don't make enough insulin, as our deaconess had said earlier, your blood glucose, the insulin is not there to break down the blood glucose, that's the sugar in your body. And so it builds up in the bloodstream. The blood sugar builds up in the bloodstream. So this is for somebody that has diabetes now. The blood sugar builds up in the bloodstream, and when it builds up and it's not able to be absorbed by the cells of the body or by the muscles, then there's a problem. It goes high. So for those that have diabetes already, you would have been checking your, monitoring your blood sugar with a glucometer. So a glucometer, when you monitor your sugar, it should be between 4 and 7.2. And if it's, after 2 hours that you've eaten, if you check it, if it's above 8, then there's an issue. So you have to keep an eye on your blood glucose levels and make sure you keep it within the normal range. So, according to Diabetes Island, I've just said a good blood glucose reading is between 4 and 7. So the factors contributing to high blood glucose, as our deaconess has said, is poor diet. High blood glucose is what I'm focusing on. So I want us to get the difference, because we have hypo also, but this is hyper. So we have poor diet, which our deaconess said earlier, physical inactivity and sedentary lifestyle. Now, when you talk of sedentary lifestyle, I'm going to elaborate a little bit on this, because many of us, we are prone to this. And sedentary is, it's sitting down a lot, lying down, you're on most of us during the COVID, we had to work from home. We sat down. My pastor was discussing with me the other day that at their workplace, they're trying to get them to have a table whereby when you've sat for long, you can now raise your table and stand. So they are thinking, and we need to think of our lifestyle. Sedentary, lying down, you're on the phone. For our kids, we encourage too much of, games. They're sitting down, watching game for hours. It's a sedentary lifestyle, So I want us to think about these things. Riding in a bus rather than, or riding in a car short distances when you're meant to walk, playing on a computer, and so on and so forth. Then another factor is not taking enough glucose-lowering medication. So for those that have the diabetes already, and it's, don't be ashamed about it. It is about knowing that you have it. Go to your GP. Once it's been diagnosed, just focus on, getting it lowered, getting your blood glucose levels lowered. And don't be ashamed about it, and don't be ignorant about it, because it's when you're ignorant that the complications come. So glucose-lowering medication, whatever your GP has prescribed, there's loads of them, but it has to be what your GP has prescribed. Make sure you're taking it. Don't miss doses, because that's a big issue. Missing doses, or or forgetting to take them at the right time, or just being complacent about it. So other factors are illness, and then if you're on other medications such as steroids, these can contribute to hyperglycemia. So the early signs. Our deaconess has already talked about diabetes as a whole, and she talked about frequent urination. So early signs of hyper is also frequent urination. So when you urinate often, of course, you're passing out nutrients in the body. You're losing electrolytes. You're losing everything that you need in your body, and it can lead to infections such as UTI. And of course, when you lose water, what happens? UTI is urinary tract infection. Sorry about that. Urinary tract infection. So you can get infected down the urinary tract. So increase, and when you lose all these nutrients of the body, when you lose water, you become thirsty, of course. You keep drinking and you keep drinking and you keep losing all the nutrients. And of course, it builds up in the eye. Glucose builds up in the eye. So these are the early signs that you see. These haven't gotten to complicated issues, but they are the signs to watch out for. And fatigue is another one. You lose energy. You get so tired, and of course you have headaches. So I'm going to talk about, the diagnosis. So of course, when you go to your GP, when you inform your GP of these signs, there's a blood test that they do, which is called HbA1c. So HbA1c is about your hemoglobin. So your red blood cells is what they're checking. They check the amount of sugar that is stuck to your red blood cells. And it's over 3 months. It's different from the glucometer that you use to check your blood on a daily basis. That is your testing. But the one the GP would do is one that they do with, which is called the HbA1c, and they test it for over 3 months. And that will show how much sugar has stuck to your red blood cells. So, this test is done in, they take your blood and they would carry out the test. So if hyperglycemia is not managed properly, it can lead to what is called diabetic ketoacidosis. And the short term for that is DKA. So DKA is when, let me start from here. Like when you have blood glucose, we all have blood glucose running in our blood. We need it for energy. We have glucose in our bloodstream, but it's not meant to stay in the bloodstream. It's meant to be absorbed into our cells, into our muscles for energy. It's a fuel for our body, for strength. But when we don't have the insulin, which Deaconess Gina talked about, which is manufactured by the pancreas. When the insulin is not there to help to move this blood glucose into away from the blood into the cells, then where does the body get energy from? Because the body is looking for energy, and that is when the body begins to look for energy elsewhere, and it goes to the fat. It begins to break down the fat of our body. So the fat is broken down. And when the fat of our body is broken down, there is something called ketones in this fat. And these ketones is actually needed for our heart, and for our muscles to function. But it breaks down fast because there is no insulin to carry the glucose, which is the fuel that we really need, into our cells and into our muscles and every other part of the body. And so when this glucose, ketones is broken down fast, ketones makes the blood acidic. And that is the big problem. It makes the blood acidic. And when the blood is acidic, it can lead to chronic complications. It can lead to coma. It can lead to death, life-threatening. So it can lead to death. So we need to be aware of these things. Many of us, we walk around and we don't want to go for checkups. We need to go for checkups, regular checkups. Once a year, we must go for our blood checkups and let them check it. Let them check for diabetes. Let them check because early intervention is important. Once they find out, they'll be able to help you and to manage it properly. And that is what it's all about, management, getting an early intervention. So signs for DKA: fruity, smelly mouth, smelly breath. Somebody passes you, you can, the breath, even you yourself, you can perceive that it's fruity. What's happening? Why is it so sweet in my mouth when you didn't eat sweet? So these are signs. Dyspnea, shortness of breath. Shortness of breath. You like, do I have asthma? Maybe you've never had asthma all your life, and then you're always short of breath, panting, dry mouth, you're nauseated, feel like you're retching, you feel like you're going to fall sick, vomiting, weakness, abdominal pain, and then, of course, coma. Because somebody could just drop, and they rush to hospital, and they're in coma for days, and then the doctor realizes it's diabetes. So, what you do, you can, when you speak to your doctor, they can give you a ketone, just like the glucometer, a glucose monitoring kit. they can also give you prescribe a ketones kit. So as you're monitoring your ketone sticks, as you're monitoring your blood glucose, or your blood sugar, you're also monitoring your ketone levels. Very important that we're monitoring for those that have hyperglycemia, that's high blood sugar. You're monitoring your ketone levels. So I'm just going to quickly read this. So if you are monitoring your ketone levels and you're reading there might be some people here that are monitoring it. So if your readings are between 0 and 0.6, it's a normal reading. If it rises from that 0.6 to 1.5, it means there's a slight risk of you having too much, ketones breaking down in your body. And if it rises again to 2.9, then that is a high risk. And once it gets to 3 millimoles per liter, it's hospital straight. You just have to go in emergency. It's an emergency situation. So DKA is very, very serious. Not many people get it, and not many people know that they have it. That's the thing. Not many people know. So, and if you do a urine ketone test also, because like as I said, I work as a nurse in intellectual disability. Many of our service users are sedentary, not because they want to be, but because they can't help it. It's the situation they're in. They have mild, moderate intellectual disability, and they have severe and profound intellectual disability. And those that are profound are mostly wheelchair bound. Those that are mild and moderate, they can move around, but if they need us to guide them. They need people that are normal like you and I to guide them on what to do, on taking, going for exercise, going to the gym daily or once a week. They need us. But we are full of knowledge. We are sane. We are okay. So we need to take this very seriously. So ketones can be checked in the urine also. So when we check the ketones in the urine, we use a dipstick. We use it's called urinalysis. So we check it, and there's a way to check it. You can get all these things from the pharmacy. And you can be checking it, like I have one at home. I check it once in a while, and I check for the family once in a while. So you can check it with this, and it will show you the colors, and it will show you how to read it. Very easy, and you can see, it's self-explanatory. And you can see the ketones, where it will tell you whether it's high or it's low, or it's, and you'll be able to inform your GP about all these things.